neonatologist and pediatrician at Motherhood Hospital, Lullanagar, Pune. And today I'm going to discuss about few common problems in newborn period so that the parenthood journey doesn't become very stressful and it makes you have an experience better parenthood journey. Okay, so I'm going to start today's session. I do request you all, whoever is listening to this session, do ask me the questions or the queries which you are facing while you are managing your babies, so that I'll be able to sort all your queries at the end of this session. So let us start the steps one by one. So most of the newborns, they do lose weight in the initial few days of life. So if your baby is getting discharged from the hospital, which is around second or third day, based on the mode of delivery, the baby's weight is going to be less as compared to the birth weight. The reason is quite physiological, because many of the babies, they do lose their extracellular fluids. So that is why it's causing weight loss in them. But the weight loss has to be in limits. So what are these limits? If I'll give you one example, that if the baby is born with a birth weight of 3 kg, the baby is expected to lose like weight every day around 1 to 2% of the birth weight. That's going to be 30 to 60 grams every day. Till what age? Till 5 days of life. And after that, the baby starts gaining weight gradually and thus regain to the birth weight by around 7 to 10th day of life. So do not panic even if your baby's weight at discharge is less as compared to the birth weight. It's quite normal. We normally ask the newborn babies post discharge to follow up on day 5 or 6 of life, so that we can actually find out that how much is the exact weight loss in newborn babies. If it is within limits, that's less than 10% of the birth weight, like for a 3 kg baby, if it is less than 300 grams weight loss, then we are absolutely okay. So this is one normal issue in the newborn phase during the first few days of life. The second issue a newborn baby faces is to have jaundice. Many of the parents, they start seeing their babies getting yellow from day 2 or day 3 onwards. So is it normal? Yes, it is absolutely normal. Almost 80% of the newborn babies, they do get this physiological jaundice. Note this term as physiological jaundice, because physiological means absolutely normal. So it is absolutely normal to for the baby to look yellow from day 2 or day 3 onwards. That's because the bilirubin levels in the newborn babies, which is the cause for the root cause for this physiological jaundice, they are slightly on the higher side as compared to the adults. And why it is so? Because the liver is subtly immature to excrete this bilirubin, and the production of bilirubin is slightly on the higher side. uh, that's the reason the babies do look yellow post day 2 or day 3 onwards. But then what is abnormal? If your baby is looking yellow within first 24 hours of life, then that is what is abnormal. But definitely your doctor is going to be looking at the baby every day during the postnatal visit rounds in the hospital, so the doctor can take a particular decision. Sometimes this physiological jaundice, it is going to increase till 5 days of life, and then later on the jaundice is going to reduce gradually over the next few days, and the normal period of this disappearance of the jaundice is by around 10 to 14 days of life. Sometimes the baby's face or the eyes might look yellow till 21 days of life, but it is if your baby is looking jaundiced or yellow beyond 21 days of life, definitely do consult your doctor. Some issues can lead to exaggeration of this physiological jaundice, like if the baby is having excessive weight loss, if there is any blood group incompatibility among the mother and the baby, so that can lead to subtly higher levels of this jaundice, which in the postnatal visits the doctor will find out and give the necessary treatment accordingly. Many of the babies, they do have normal newborn skin rashes, which make the parents a bit worried about. So what are these rashes? These are subtle changes in the skin which happen in the postnatal period after the delivery of the baby, which you see, like there's something called as erythema toxicum, which is a erythematous blanching rash. So the baby might look more red, especially on the cheeks, as well as on the trunk, on the belly. So that's quite normal to have this rash. This rash normally appears by third or fourth day of life and disappears by around 7 to 10th day of life. Anything extra need to be done for this rash? Nothing. It's just a physiological rash in the newborn period, and that's going to disappear gradually over the few days of life. Some white spots might be noticed on the nose or the chin of the baby starting from first day onwards. So these white spots are basically a blockage of pores of sebaceous ducts. Like in we get pimples, similar sorts. Our pimples are because of blockage of sweat glands. This milia, what we call, these are the white spots on the nose and the chin of the baby, are basically because of blockage of sebaceous duct. Once you start bathing the baby, as per the advice of your doctor, this small white spots will disappear gradually. Many of the parents are worried when they see some peeling of the skin of a newborn baby. So do not panic. These are normal dead skins which are getting shed off from the baby's body, and the baby being in growing phase, even the skin is growing, so that those dead skins are getting replenished by new skin. So that's absolutely normal to have this pilling or dryness of the skin, which many of the term babies experience from day 2 or day 3 onwards. I would like to stress on some female babies. Female babies, with respect to vagina, there are chances that you might notice some vaginal discharge, which is white in color. That's quite normal to have this vaginal discharge. So you don't have to be forcefully removing it. Gradually take time to remove all this discharge. Do not have more friction in those sensitive areas. So while you clean it up, let it be like patting, and then taking off that, and it should not be a friction completely when you take off such discharge. There are chances that the female newborn babies might experience some spotting of blood from the vagina from day 3 or day 4 onwards for a day or two, and then it will disappear. That's because of the hormonal changes, especially the hormonal withdrawal, which happens in the female babies post delivery on day 3 or 4 of life, and that is why they experience that spotting. It's going to stop by its own in a day or two, and we should not panic about it. Most of the babies, the parents complain that there are lots of hiccups the baby is experiencing. Is it normal to have hiccups in newborn babies? Yes, absolutely normal to have hiccups in newborn babies. That's because of the regurgitation of the milk from the stomach to the foot pipe, and that is what is causing the diaphragm activation, and that's what is making the diaphragm to contract. It is a muscle which separates the chest cavity from the abdominal cavity. So when the milk is coming or milk is getting regurgitated from the stomach into the food pipe, this is what leads to more contraction of this muscle, and thus the baby have more of hiccups. The only treatment for this is give good burping to the child post every feed, and this hiccups issues may subside subtly. Most of the babies, they do pass gas, especially when they are on mother's milk. So it is quite normal for them to pass a lot of gas while passing stools, or even in fact without passing stool as well. But the baby should not be cranky. So if your baby is experiencing excessive gases and the baby is cranky at the same time, it can be a part of colic component, which is a pathological entity. But just passing gas, it's quite normal. They have this gas issues. That's quite normal to have for all the babies. Most of the babies, they sleep for a very long time. So parents do always tell that it's a task to wake up a sleeping baby. Okay, but make sure that when you are feeding your baby, let the baby be completely out of the sleep, especially during the first 2 weeks of life, wherein the baby is more sleepy. Around 18 to 20 hours of entire day the baby is in the sleeping mode, and the remaining time the baby will wake up, have the feed, and sleep off completely. They normally have a sleep pattern which gets established by the end of first week. Most of the babies, they do sleep more during the daytime, and nighttime they are more awake, so they might ask feed every early in the night, and they might be sleepy, so they might ask for feeds for every 3 to 4 early during the daytime. So that's quite normal to have. As I said, that the parents complain that it's actually a task to wake up a sleeping baby. So there are certain methods to wake up sleeping baby. Like you can open up the baby completely, rub the back of the baby, as well as give subtle gentle strokes on the soles of the baby so that the baby is out of the sleeping phase completely, and then breastfeed the baby ad lib, and give a good burping post feeding. Over the next few days, babies also do experience certain cluster feeding episodes. So mother might start thinking, now my milk flow is inadequate. Maybe that's the reason the baby is asking for more and more feeds. But this is not the situation. The baby is making mother's body, it is preparing the mother's body for the growth spurts what the baby is experiencing. A typical period is around 3 to 6 weeks of life. So they feed onto the breast for a longer duration, as well as maybe frequent feeds might be asked from the baby's side. So that's quite normal to have this cluster feeding episodes intermittently lasting for around 2 to 5 days, and then the regularization or the normal pattern what was there prior, it gets established gradually. Sometimes parents do complain, especially in the night. Babies have some snoring or some sort of noisy breathing. Their nasal mucosa is very, very sensitive to air draughts or maybe some fan or AC currents. So, because of that, the babies might sneeze. So, sneezing, infrequent sneezing is quite normal. But if your baby is experiencing blockage of nose, definitely do consult your doctor. There are certain normal saline drops which are quite safe to be used and to be put into the nostrils each time when your baby is experiencing this noisy breathing. Okay, so these are few common issues which normally in the initial phases, especially new parents do face. So try to sort a few of them. I think we can start with the question and answers. So if you have any doubts in your mind, do let me know so that I can sort and all your queries right now. Biggest health concern for an infant, even if it's a term baby, the temperature instability which a baby can face, and that can make the baby prone for not gaining weight or infections, is the biggest health concern. So it needs to be mandatory that your baby is being kept warm, especially not only the trunk part or the chest part or the body part. The warmness should also be present in the hands and the legs of the baby, because these are the areas wherein the baby might feel cold more and more. So make sure that your baby is absolutely nicely wrapped. There are chances that you might wrap the baby, and during the summer season the baby might feel more cranky because it's quite hot. So it varies with the environmental temperature, how many layers of cloth you need to wrap the baby. Yes, but the biggest health concern for infants is the maintenance of temperature, because based on that everything other things are related. Even if the temperature is not maintained properly, the baby may not gain the weight what is actually we are expecting. So yes, next question. Normal behavior for a newborn. So what is normal? As I said, that sleep pattern I have already discussed. So the baby is going to be more sleepy in the initial 1 or 2 weeks of life. That is quite normal. The other thing that they will start giving you subtle feeding cues. So when they are awake, they might play, they might move their hands and the legs in the rhythmic motion. So you need to give subtle portions wherein the baby is slightly open with the help of maybe mittens and socks. Make sure that your baby is moving all the four limbs. And when the baby gives you starts giving you feeding cues like rooting, when some object touch their cheeks, they try to lift their this thing, the neck on that particular side. So this is what is rooting. Sometimes they start making sounds which tells that the baby is hungry. So these are subtle feeding cues. So that's quite normal to have this, and you can feed the baby during that time as well. Next question. How do I get my baby to sleep during the night time? As I said, these patterns are established since the baby is in the womb of the mother. So I would tell you the basic fact why the babies are more sleepy during the daytime and less sleepy during the night time. Because when the baby is inside the womb of the mother is most of the time active and working during the daytime, during the pregnancy or the antenatal period. So the baby, they do get this rocking motions every time. So they are more sleepy in the womb itself during the daytime, and when the mother is resting in the nighttime, this rocking motions are gone, and that's what make them awake in the nighttime. And the same pattern which is there established in the womb of the mothers, the same pattern the newborn baby follows postnatally, post delivery. So that is why they make more sleepy during the daytime and more active during the nighttime. So it is not possible for us artificially to change the sleeping pattern. Let your baby decide when the baby wants to change the sleeping pattern. We cannot force any baby to sleep during the night time if the pattern is already established. But yes, you can give some swaddling so that they feel comfortable. You can give them skin to skin contact so that they feel comfortable, and they might take better naps during the night time when you give this swaddling, which is making the baby comfortable by giving clothes around, or wrapping the baby with clothes, or maybe giving skin to skin contact with the mother, can make them certainly more sleepy during the night time as well. I can't get my baby to stop crying. What can I do? So basically, we need to find the cause why the baby is crying. So if the baby is hungry, definitely, if it's a hunger cry, feeding should sort this issue. The other reasons why the baby can be crying is because if there is nose block, like I said, if there is noisy breathing, they cannot feed properly, and then they have this issues of more of crankiness. The other few reasons that the babies might have wet diaper or wet nappy wherein the baby keeps crying. The last and sometimes uncommon reason being colic. So it will be better that you, if all these issues, so normal issues which can make the baby cry, if those are sorted out, then it will be better that you show it to your pediatrician. It can be a colic component, which is abdominal pain in the baby, wherein which makes the baby more cranky, especially if it's a late evening cry or the night cry. The one of the reason can be infantile colic as well. Why can't I put anything in my baby's crib? So basically, I do recommend rooming in and bedding in. So I will not recommend more of use of crib. But even if you're using crib, it's not recommended to put many the same toys or other things in the crib. The reason only being is that any object which can happen to press the nose of the baby, which can make the baby prone for sudden infantile death syndrome. That's the only reason we don't advocate prone nursing, in the sense sleeping or making the baby sleep on the tummy, or having many soft thing across the baby, so that the risk of nose block, and which can be a cause of sudden infant death syndrome, is prevented. That's the only reason we don't recommend, especially the baby being put in the crib, as well as preferably bedding in with the mother, so that the baby sleeps on the same bed as that of the mother with skin to skin contact, and no soft objects to be kept across the baby every time. How long should I breastfeed my baby? So as per recommendations, yes, definitely exclusive breastfeeding needs to be done till completion of 6 months. So it is not the completion of 5 months and start of 6 months, it's the completion of 6 months. Till then you have to give only and only breastfeeding. Many of the parents do ask that should we give extra water, especially now is the summer and suddenly the heat wave has started. So there is no need for extra water. The mama has to keep herself well hydrated. Milk composition itself is such that 70% of the milk composition is water, so you don't have to give extra water to the baby. This breastfeeding after completion of 6 months, we do advocate use of complementary feeds, and the breastfeeding journey has to continue along with complementary feeding till at least 2 years of age of the baby. How do I know my baby is getting enough of breast milk? So there are certain criterias which tells us that the baby is receiving good amount of breast milk. That is what adequacy of breast milk is. There are basic three criterias: that your baby has to pass urine almost 6 to 8 times, including day as well as night. The other criteria is the baby has to gain weight gradually. So normally a term baby gains around 30 to 40 grams of weight gain every every day. So in a week's time, postnatally from 7 days or 8 days onwards, the baby has to gain around 200 to 250 grams every week. The third criteria which tells that baby is receiving adequate breast milk is that the baby is sleeping in between feeds at least for an hour. So all these three criteria states that the baby is receiving enough of breast milk. Next question. What is the single most important thing I can do for my baby? I would say temperature maintenance, this breastfeeding. So, breast milk is the best thing you can offer to your baby. So, along with good temperature maintenance and good, adequate breastfeeding with adequate burping, these are the things which are crucial for the initial few days of life. Any other question? So it is. I would like to stop this session by saying that it's a beautiful journey of parenthood. Do not panic. Doctors are always available for your help, but definitely there are certain common things or common problems in newborn period, which I hope I have taken a good effort to sort all these issues, so that you don't have to visit the doctor also for multiple times. But yes, definitely, if you have any queries, do visit your doctor, and the doctor will definitely need the helpful for you. Thank you so much.